All right. Hello, everybody, and welcome back. We are here for the March edition of the DuPage ROSC Council meeting. My name is Jarrett Burton. I am your DuPage ROSC coordinator. Additionally, I'm a person in long-term recovery from substance use and mental health challenges. Glad to be here with you again. If we could start by the usual, just asking everybody online just to make sure that your microphone is muted unless it's time for questions or comments. That'll help us in cutting down on interruptions. If you look on the participants list and you see a black screen with a dot in the middle, that's Danny. That's his mute trigger finger. He's ready to go if drafted. So it'll help us cut down on interruptions. We appreciate that. So also, if you're digital, if you could put your name and contact info into the chat, that's really helpful for us in taking attendance. If you're here in person, my colleague Annette has a sign-in sheet. I'm sure she'll bring around for everybody. Also, I'd like to start by inviting anybody who is at their very first DuPage ROSC Council meeting for the very first time to introduce themselves. So is there anybody here for the very first DuPage ROSC Council meeting? You guys are pros. Anyone online here for the first time? Looking at the names, they all look familiar. All right, so we're all here, back again. Glad to have you with us for the first time or the 100th time. Glad you can come back month after month. Last month, I actually tried out an icebreaker at the beginning of the meeting, and that was so great. I was talking about self-care and invited people to kind of describe the ways they practice self-care in their own lives. So there was like a ton of really good suggestions for ways to practice self-care. So it also helped me to kind of get to know some of y'all a little bit better. I know we kind of work in the same field or we operate in the same kind of recovery community, but the more I get to learn about people is awesome for me too. So I wanted to try another one. This one is one of my favorites. This is one that I ask when I go into teach classes inside the jails, which is talking about your bucket list items, meaning like what's the one thing you'd love to do while you're still here on planet Earth. So that could either be like a trip or an event or something you've always wanted to do but just haven't yet. If you would like, you can raise your digital hands or you can raise your hand here in person. And like I said, my colleague Annette can go around with the microphone. I'm going to start with two. I'm going to do two so that I can give people time to think about theirs if they don't have one in mind. Two things. First is a sporting event. So I would love to be able to attend a Cubs World Series game at Wrigley Field. I won't hold my breath on that because that's reliant on them making it back to the World Series and then being able to afford a ticket to Wrigley Field. So I won't hold my breath, but hopefully that won't be like another, what was it, 108 years, I think? Okay. But by then we may have technology that can like extend our lifespan. So maybe we can, yeah, as Ben said, a dreamer. The other item, and I was describing this to Annette earlier in the office. Some of you may have heard of this. I guess a lot of you haven't. But there's an island in Japan, off the coast of Japan, called Aoshima, and it's a fishing island that slowly, over the past 100 years, has been taken over by cats. I don't know if you've seen this online, but there's like 36 cats for every one resident. And they originally came over a couple 100 years ago on fishing boats to help keep down the rodent problems, and then they just made it their home. And so every year they kind of breeded more and more. And now you can visit this island. There's just like hundreds of these cats. And from the moment I saw it, I was like, that seems amazing. And it's not like I'm really that big of a cat guy. I just think it's such a weird kind of unique experience that I feel like it would be something really cool to attend. So those are my two, but I would love to hear some of your bucket list items. So if you want to raise your digital hand, you can. I do see our friend John Skos has one. So John, you can go ahead.
Hi, thanks. Probably mine would be just to drive the original Route 66, but I'd like to do it in uh, a convertible Corvette, maybe one from 60s. Yeah, that would be
Is
mine.
there a specific 60s year or just from the 60s?
Uh, I would say just from the 60s. A Shelby at some point would be great if I could get my hands on one.
Okay, yeah, we're getting some affirmations here in the room. So yeah, you've chosen a nice one there. Thank you, John. Anybody else online want to tell me one of your bucket list items or here in person? I can come around with the mic. Hang on, Annette has got one. You got a person or you got one? Okay, she's got a person. She's going around. We're gonna bring the microphone around, Alex. Don't worry.
Thanks. Good morning. Oh my gosh, good morning. Oh my God, it's been a long day. Good afternoon, everyone. Alex Milkamp from Family Shelter Service. I love elephants. So on the same note as cats, kind of with animals, I love elephants. So I'd love to go to like an animal elephant sanctuary someday and just be fully immersed with them for as long as humanly possible.
Amazing, amazing. There was one in the chat that says, "See the Northern Lights in Norway," which sounds amazing. Anybody else in person have one? Even if it's not attainable, do you have one? Okay, we got Roger Stefani, Hope for Healing. Just make sure it's switched on.
Okay. I would love to see before I leave this earth, the Chicago Bears in a new stadium playing for an NFC championship.
Yeah, just
That's a good one. We won't go full on Super Bowl, but at least NFC Championship. All right.
okay. Do I feel comfortable with what? I guess one more time.
All right.
Yeah.
Do we have to use the mute trigger finger? All right. Anybody else before we start getting into things? Okay. Well, thank you to everybody who submitted theirs. We appreciate that. And again, like I said, it helps me to kind of get to know everybody every week by doing these types of things. So thank you for your submissions. So let me get Cat Island out of the way. Let's do some share screen and go over a few things. And then we'll kind of jump into the meeting. Okay. Let me get to the beginning because there's quite a few things. So none of you were here for your very first ROSC meeting, so I don't feel the need to go over all of the particulars again about what a ROSC is or what a ROSC does or what DuPage ROSC does, but just in case for a quick overview, a recovery-oriented system of care is a model that brings together people and organizations on the recovery continuum led by people with lived experience in recovery to kind of identify the strengths and areas of need as it relates to substance use and mental health in DuPage County. We hope to kind of create a more seamless system of care. It helps to reduce the silos we work in, and it hopefully reduces stigmas attached to substance use and mental health challenges by really centering the voices of the people who found recovery in DuPage County. So we work in a number of different areas on that continuum. So as you'll see by the people here at this meeting and some of the work we've been doing, it goes beyond just treatment centers and things like that. There's a number of different areas on the continuum that ROSC members do their work on. So we're glad to have them all here as we kind of build this culture of recovery here in DuPage County. So let's go over today's meeting specifically. Now, I did not have a chance to update this yet. If you saw my email before the meeting, unfortunately, Nicole from RCA is not feeling great. I think there is some kind of bug going around. I think I've heard it from at least 5 or 6 different people talking about not feeling great, so we totally understand. We hope that she can make it back to a future meeting. So after we kind of go over a bunch of our usual stuff, so updates on meetings, training, some of these other grants we're working on, we're really going to try to dig into some of the ROSC community survey report. So we've been talking about that over the past few months. Blake and I worked on the reporting and the results of that, and we have some of that to go over with you. And then we'll try to leave some time. We actually probably will definitely have some time for some organizational updates, and if time allows, we'll give you a few minutes of your day back. So let's go over a few things. First up, next week, our DuPage ROSC presentation series returns. Our one and only Blake Warman, Recovery Navigator, will be presenting on Ibogaine. Blake, if you're on here, do you want to unmute and tell us again what Ibogaine is so I don't butcher the definition of it?
Yeah, so that is a West African shrub that the root bark is used of in traditional coming of age ceremonies. It is a psychedelic. It's related to other tryptamines such as DMT and psilocybin, but works in a different manner. The actual targets of it within the brain are complex and not fully understood. One of the targets that it works on are the mu opioid receptors in a mixed agonist and antagonist function. and it has been shown to completely alleviate withdrawal symptoms, to interrupt the addiction cycle, and to be a powerful tool in fighting the opioid epidemic and addiction.
Thank you very much. What he said, all of that. But yeah, Ibogaine is one of those kind of like alternative treatments for opioid addiction that I would hear about going back probably 15 years plus. And it was one of those things that was like never readily available for different reasons that we'll find out during that presentation. But it should be a good one. A lot of y'all made the time to come a couple of weeks ago when I did the presentation on nitrous oxide. I got a ton of people asking for those slides and that video. So hopefully we'll just continue in this mold of having presentations on stuff that's kind of either on the cutting edge or stuff that's happening in the substance use and mental health world in our area. So looking forward to this. This is next Wednesday at 10 a.m. and those are on Zoom and are completely open to the public. So we hope you can join us for that one. Do you know where to get Narcan access in DuPage County for free? There's a few different places. You can always go to Hope DuPage, or you can look at this list here. We are always looking for new partners to put our boxes at their sites. And so if you are somebody who your organization could benefit from having a box that distributes 100% free Narcan, no questions asked, go ahead and reach out to me because we're always looking for partners. We are looking in some specific geographic areas, like I know kind of the northwest side of DuPage County, as well as the complete opposite, which would be the southeast side. So if you work in those areas and you feel like your area could benefit from something like that, just let me know and we'll have those conversations. But yeah, Narcan is always free and should be easy to access in DuPage County. All right, is Jordan Esser? Jordan, are you here? I can only see so many people.
I'm here. Hi.
Hi, Jordan. Do you want to talk about this fun event that'll be coming up next month here in Addison?
Yes, I'm so excited. So we are planning, we're calling it a town hall. And this is in partnership with my coalition, the Prevention Leadership Team, and Serenity House and the ROSC. And we're calling it Help Teens Have a Summer to Remember. So it's scheduled for April 15th. We're trying to get it in before end of year school craziness gets too insane for everybody, and obviously before summertime. So our goal with this event is to educate parents, caregivers, but even people that work with young people and teens, I think would benefit. We will be splitting the time. So I will be taking the primary prevention piece and kind of sharing what the data is telling us in DuPage County, what teens are reporting using, and some other pieces of data. And then how to talk to teens about substance use and prevention and the importance of that. And then just very high level overview of what the risks are associated with youth, alcohol, marijuana, and tobacco use, because those three in particular, data tells us are the top three that our teens in DuPage are choosing to use underage. And then Serenity House is going to take the second half of the time and do more of the harm reduction and how to intervene piece. So how to recognize signs of potential use, what resources are available, what parents can do to help intervene and help their teen. So we're hoping to get people out. We will be hosting it thanks to Jarrett and his relationships with the Addison Township offices. We'll be over there. And I am also hoping to bring some hidden in plain sight I can't think of the word.
It's like a mock-up. It's like a mock-up,
yes.
Right?
Thank you. Yeah. It's like a full bedroom or a trailer. I don't want to do that, but we can be building our own kits. And so that's something my team is working on. So I'm hoping to be able to bring some items that show, I'm sorry if you can hear my son in the background, how teens might be trying to conceal. So it's hopefully going to be a timely event for parents and prepping for summertime and how to keep their teens safe and healthy. Annette will also be there to provide Spanish translation. I don't necessarily plan to get the flyer translated, but I would like feedback on that if people think that that's needed, or we probably have time to do that. But no registration required, no fee. We're just trying to share some information with parents that might need it.
Awesome. Thank you, Jordan. So yeah, all are welcome to come to that. It's over, like she said, at the Addison Township offices. If you've not come over to visit us, the ROSC, I mean, at the Addison Township offices, we'd be happy to come over and have a meeting with us. So just let us know. But yeah, in April, we hope you can join us at this. So it should be good as we lead into summer. Lots of good information, harm reduction materials, all kinds of good stuff. So really looking forward to this one. So thank you, Jordan.
Jordan?
Hold on, Donna. Yeah, go ahead.
Yeah, Jordan, you
Hi,
asked a
Donna.
question about, hey, how are you? Haven't
Good,
seen a
how are
long time no
you?
see. I'm good. I'm wondering if it would not be a good thing to have it in Spanish.
Okay, all right. I'll go ahead and get it translated. I'm gonna try to work with Lark because I know they have a grant that can do this for free right now. So yep, I see Beth just put that in the chat. So that was the route I was gonna go. So I will
Great.
send that over later this afternoon or first thing this morning, and then I can share that as soon as that's available.
Great, thank you. I really
Mhm.
appreciate that. Okay,
Yeah.
thank you.
Yeah.
Excellent. Thank you. Few other things to go for. She's right in front of me. Felicia Maselli, everybody. It's like a celebrity. If you have not attended one of Felicia's grief and loss groups at some point, we have those here at Serenity House, second and fourth Thursday of every month. Processing group for anybody who's experienced some type of loss because of addiction. It's a lot of really good lived experience in that group, and a great way to find support if you need it. So yes. Okay, so yeah, you see that phone number on that flyer, and I can share this afterwards too. This particular meeting may go down to once a month, so call that number, which is Felicia's hotline, and check to see because that may go down. But yes, great grief and loss group. If you know somebody who is struggling with this, could use some support, it's a great outlet for that. So hope you can join us for that one. We still have the Friends and Family Smart Recovery. So we got that Thursday, 6 to 7 p.m. If you're unfamiliar with Smart Recovery, it was kind of originally as an alternative to 12-step. Doesn't deal with a whole lot of spirituality, deals more with CBT, DBT, goal-based recovery program. So if that sounds like something that someone in your family or friend could benefit from, learning a bit more about addiction, learning a bit more about that recovery process, welcome to join us at that one as well. Danielle, come on down. I'm going to put you on the mic for a second. Where's that other microphone? Is it still? Oh, is it in front of me? Oh, it's right here. This is how scatterbrained I get sometimes. Microphone's right in front of me. Danielle, do you want to talk about some RCO related things?
Yes. All right. Hopefully you guys can see me on the laptop. So we have our Stony Brook Smart Recovery meeting every Wednesday from 1 to 2. And attendance has been booming at the meeting these past couple weeks. So we're trying to boost attendance for quite some time. So we would love if anybody would like to join us. Again, it's at Stony Brook Center every Wednesday from 1 to 2 p.m.
I don't have the flyer up, but the virtual Narcan training is on which day? The third Thursday, right?
Yeah, the third Thursday. It's next week.
Okay, sweet. So if you need a virtual Narcan training, we do that on the third Thursday of every month at 12:30, and we can provide that flyer for you if you need it. So thank you, Danielle. Danny Sorbis, your turn. Danny handles the CORS grant for us, and he's going to give you the rundown on all of that stuff.
Hey everybody, Danny Sorbis. I coordinate the Community Outreach and Recovery Support Grant, or CORS for short. Priority population are those who are unhoused or risk of being unhoused, those who have substance use or opioid use disorder, and those at risk of overdose, incarceration, and medical complications. We do a combination of what ROSC and RCO does, harm reduction training and education, coaching services, referral connections, street outreach. So if you have any questions and you want to email in the chat to connect with you.
Give the quick once over for these meetings that I have up here. If you want to, we'll start with the refuge.
I definitely can. Part of what we do, since CORS is through 8 different counties, we do some virtual and hybrid meetings. So the first on the screen right now is the virtual refuge meeting. That's every Saturday morning from 10:30 to 11:30 a.m. Actually, starting in April, we're going to be making that hybrid. So right now it is virtual, but starting April, that'll be hybrid with the in-person being here at Serenity House. Again, that's 10:30 to 11:30 a.m. It provides an alternative to just your traditional 12-step meetings. One of the meetings we have right now that is hybrid is our veteran support group led by Jim Murphy. That is Thursday evenings. The in-person is here at Serenity House, but you can also join via Zoom from 6:30 p.m. to 7:30 p.m. every Thursday. And the last one that we have is the virtual smart recovery meeting. Again, this one will be moved to hybrid, just like the refuge meeting, every Saturday morning from 9 a.m. to 10 a.m. So in the month of March, it'll remain virtual. Starting the first Saturday of April, it will be hybrid. Again, any questions, please feel free to reach out to me, and I would love to get you there.
Excellent. Thank you, Danny. And thank you to everybody who went over all of those meetings. I'm going to stop my share for a second. Blake, is it easier for like the resource stuff for you to share, or do you want me to share it on my end?
I can share it. I've got it pulled up already.
Okay, let me stop the share. I do want to turn it over to my recovery navigator and colleague in the ROSC, Blake Warman, who's done a great job in working on handling the WhatsApp referral hub, which majority of you are part of. He's also helped out building these resource guides and asset maps. And we're going to go over a few of that. So Blake, why don't we start with the WhatsApp referral hub update for this month, and then we'll move on to some other stuff.
All right, quick update with Referral Hub. We're up to 141 currently active members. We provided 32 referrals last month, with Becky Sadler being the MVP. So I will be contacting you to get you your gift card. With those referrals last month, we had a lot of requests that really displayed the depth and breadth of knowledge of our members. When discussing the finer points of what insurances are accepted where, new policies after mergers, and an expertise of placement options for clients with otherwise challenging or limiting traits and circumstances, we were able to provide referrals for all of them, which really highlights why we started all of this in the first place. Over the next couple of weeks, I will be reaching out to everyone who is a part of that to get updates to all of our contact information. Whenever I send out the resource guide and the asset map, I get a bunch of bounce back emails. So I want to make sure that I've got everybody's correct contact information. And I will share my screen. One of the outgrowths of the referral hub was the resource list. This is great. This is very informative. Everyone who is a part of this has been listed on there. I've made it as easy as humanly possible to navigate. I know that not everybody likes spreadsheets, so I've tried to make it as painless as possible. At the end of the day, this is still a spreadsheet. So my ultimate vision for this was to try and get something that was easily searchable, or that you could input more and more variables and get a further and further refined list. While I was not able to do that with the spreadsheet, I was able to do it with the asset map. This has all of the information that the spreadsheet does, but it is searchable and it works on mobile, which is not something that you can say about the Excel sheet. If you click on one of the drop pins, it will pull up with everything that is listed on the resource list. The pins are all listed on different layers. It's not a one-to-one translation of the pages that are on the resource list. However, I've combined like items, and if you want to make this less visually cluttered, you can check off layers and limit what is displayed to you. So you can search for everything which is geographically convenient for you. You can also search the entire document. Let's say that I want to search for Blue Cross Blue Shield. I hit enter. It's going to visually highlight everything that matches that. Or if I type that into the search bar, I now get a list of all those places. I can click on highlight all of them, and then it will also visually identify them with the white ring around them. I made that as straightforward as I possibly could. As the resource list gets updated, that will be updated too. And let me switch
Yeah.
to.
Real quick, if anyone wants to check this out right now, you can like pop into our Facebook page. We have it like I think it might still be pinned at the top. So if you want to check it out, test it out. If you are somebody who, you know, works for someplace, I want to say within reason, like sometimes we'll get requests from people who just check SEOs and we're like, hey, we're from Northern Michigan. Can we get listed in your thing? Within reason. So if you are somebody who's like works in Northern Illinois in any of these different sectors of the continuum, and you're not listed, just let us know and we'd be happy to put you on there. The idea is that this is kind of like one of those living document things that's like constantly updated. But we feel like we've got a pretty good start on, I don't know, as many resources as we could fit into one possible thing. I don't know, Blake, was there any areas we may want to try and extend on, or is there any areas that we haven't hit yet?
There's always room for improvement with even the ones that we do have a fair amount for. Like you said, I want it to be a living document where I'm continually adding more for it. I have a whole book of resources out of 2 different counties that I'm going to be adding to that as well. The goal is to get all of Northern Illinois covered and then start moving slowly south, to expand to some of the surrounding states, really try to make it as useful as possible to everybody within the central Midwest area. The next thing that I wanted to talk about was our community needs assessment survey. So
let me do a quick preamble before you get into some of this. For those of you who are kind of like unaware of Blake, are you trying to show 2 screens? Okay, yeah. So the ROSC community survey was something we did in conjunction with IDHS Super, who had a number of their own questions they were looking to get answered about, you know, attitudes and awareness of services, trying to take a look at their own strengths and gaps in services at a statewide level. So they had given us about 10 questions that they were really looking for the answers for in all of the individual areas that the ROSC operate in. In addition to that, they kind of told us, hey, feel free to add on to these questions if it's stuff that's specific that you're trying to find out about DuPage County in addition to these, just add those together. And so we did, and we put this community survey out a few months ago. I in the feedback that I gave to the state, told them I wish that we maybe had a different time of year to put this out, just because in the wintertime with holidays and stuff, sometimes that could be counterproductive in trying to get people to fill out surveys. Plus, I don't know if you know this, there's like 3 or 4 other major surveys happening at the same time. Sometimes there's like survey fatigue. So we did the best we could to burrow in and try to get some of the answers to these things we were looking for. So having said all that, Blake and I, last week or 2 weeks ago, kind of put the finishing touches on some of the reporting for this, and we are going to go over some of that. Blake, what was the stuff that you wanted to touch on specifically for the survey stuff?
you can do the executive summary. I've got some other stuff that's not listed on that.
Let me share the screen real quick and we'll go over a few things. Okay, so I am going to make sure to provide all of the individual answers like this for folks. It might be not as productive with the time we have to go through each question like this. So we kind of have like a high level look at some of the reporting, some of the answers we were getting from folks, and then we're happy to provide individual answers and responses to people if that's what they're looking for. But I wanted to go over some of like the key findings. And the way we did this was through a number of different ways. It was, you know, blasted out through our email list, the health department, Hope Task Force, a bunch of different places were able to push that out through their network. We also went out and actually put up physical flyers with QR codes. So there's a number of different ways we did it. But some of the findings that we got back from all of these surveys, and when you see SPs or you hear me or Blake refer to SPs, that's just survey participants. There was no easier way to do that. But kind of the key things, right? So overall, the people who did take the survey kind of feel, and I'm going to kind of zoom in a little bit, did feel that there have been positive changes in the perception of substance use and mental health challenges in our area, but we still have room for further kind of like shifting into the more positive areas. The efforts of IDHS Super and the ROSC, but also the federal efforts that have been used to address specifically the opioid and fentanyl crisis have been largely successful in responding to the crisis. Now, I know that there's a lot of room for interpretation in that one because we are still smack dab in the middle of an opioid crisis, but at least the work that has been done has started to kind of make a dent in some of that. There was also kind of like this appetite for further funding and expanded efforts in providing services and community efforts in not only meeting, but like treating substance use disorder and mental health challenges. We kind of are lacking some of our own extended residential treatment centers and other things that some other counties have a leg up on us in. A lot of folks felt that DuPage County suffered, like I said, for being a desert in regards to the specific needs for inpatient treatment. Transitional housing was a big one. You're going to hear housing as a refrain through a lot of this reporting because that was definitely a huge area of need. Even temporary. Those of us who do a lot of timely work with referrals, sometimes we'll get those questions of, hey, you know, I've got a guy who's going to sober living, you know, in 2 weeks, but he just needs somewhere to go, you know, in the in between time. That type of stuff really doesn't exist. So we're trying to find ways to put band-aids on those particular types of referrals, but I think other people noticed that too. They also indicated that they felt like finding the more generalized substance use treatment in DuPage wasn't necessarily difficult, but the accessibility became an issue. So whether that was economic, insurance-based, linguistic, but also like culturally competent treatment was not accessible to everybody equally. There was an interesting question about having empathy for the unhoused. We did have some questions in there about unhoused people and attitudes towards them, and it was largely positive. But the people who took it also felt that some of the more polarizing harm reduction efforts, and when we say polarizing, we're talking about things like methadone specifically for MAT, but also needle exchange programs. We do get the feedback that those are, in fact, effective methods, and people would like to see expanded efforts for both of those in our area. But then there was also some ambivalence about the ability of court systems to treat substance use disorders. And then lastly, the kind of overview thing was people who took this were describing difficulties in transportation. Now, transportation is another one of those barriers that you're going to hear repeated through through this reporting. But I think that was a common one, and I think that's one of the ones that we see in a lot of people. As far as gaps and concerns, before I kind of turn it over to Blake to talk about some of the really interesting ones he noted, the transitional housing, as we mentioned, but also sober living. Now, we know that there's an attempt to kind of improve on that. Now, for one example is Oxford House. When we started the ROSC 3 years ago, I think there was maybe one Oxford House or two in DuPage. I think at last I checked, there was like 14 or 15, maybe more. But that's just one outlet, right? But people really did report the need for transitional and sober living far outpacing what was available. Treatment options for uninsured. I think any of us who worked in this field have dealt with that at some point. Lack of providers that accept Medicare and Medicaid. Hopefully that'll change in the summertime as Medicare and Medicaid open up some of the things you can bill for. But also sober living options, residential treatments for specifically mental health. That's another one we hear, that there's specific residential treatment for substance use or there's sober living, but people felt like if the primary thing was mental health, that type of housing wasn't as readily available as the substance use housing. Again, here, not an immediate distinguishable place in the consciousness, but just kind of where to go for treatment, awareness of options, awareness of like how to navigate the referrals or how to navigate resources, and being able to make people aware of what's out there. Childcare, that was another one. A lot of people who have children, especially young children, that can be a huge barrier because of lack of childcare, even for things like outpatient. And then there were some other things. Obviously, a language barrier does pop up as well, and hopefully, we're doing what we can to kind of improve on that. But those were a large kind of a overview of some of the main takeaways, the gaps and concerns. Blake, what did you see in some of the like observations that jumped out at you?
So I was trying to figure out how I could pull some meaningful data out of this. And one of the neat things that SurveyMonkey lets you do is you can apply all kinds of rules and filters to your data. So one of the first things that I did was to filter by age bracket and by income level. So I will pull up the side-by-side ones. Now, for the most part, no matter what the age group was or what the income level was, they were pretty much on par with each other, with a few notable exceptions. The first one being question 8. 80% of the participants in the 55 plus age group either agreed or strongly agreed that MAR is an effective treatment, while only 65% of the 18 to 34 age group strongly agreed. If I scroll down to question 12, this is the question that I would have thought the age group would have had a bit more of an impact on, but both groups are essentially the same, or they at least feel largely in touch with one another. I sort of naturally expected the slightly older age group to not have as favorable of an opinion. I feel like that's more of a recent thing, but I was surprised by a fair bit of the data here. Further refining that down, we had developed a question to specifically target how syringe programs were viewed by the community, and both age groups have an 85% approval rating for them, which I did not expect. Now, question 14. It is difficult to find harm reduction services like Narcan and syringe services and syringe service programs in my community.
Can I say something about this one? I'm probably
Yeah.
gonna say what you're gonna say, Blake, which was we love our friends at the state. This was one question they asked us to put on here, and the only issue I had and with this specific question is harm reduction is a wide range of things, and I feel like we have picked two things on the opposite end of the spectrum. So on one end, you have Narcan, which, although there's still some pushback occasionally, for the most part, Narcan is kind of like universally almost accepted at this point. Syringe service programs are going to be on the opposite side of that. So as important as syringe service programs are, I feel like that's going to be one of those areas that's always going to be the hardest to try and convince people about. So do you feel like you had a similar takeaway from that specific question?
Not as much. Like when I was looking at this one, I was trying to figure out what it was telling me, because at first glance, I couldn't quite tell. You can see that right away with the 18 to 34 age group. This is essentially split in half for those who agree and those who don't. When you go over here, there's a sizable percentage that neither agrees or disagrees, and it wasn't immediately obvious to me what that might be referring to. And I feel like that answer signifies that they might know where to get it, but that there is some limitation or challenge with obtaining it, such as geography, business hours, or price. If I go over to filtering by the income bracket, once again, these are mostly the same on par. I'm going to be conscious of time and not go through question by question. So let me scroll down to question 14. When we get to assessing the knowledge base of harm reduction programs, you can see the clear difference. One question lets you discern both the ease and difficulty of how the age groups see this. When you're on the under 25,000, you've got roughly a third. Once you get to 50,000 and higher, you're sitting at about 45% know where to go for that. On question 17, this is one that I really expected to see a difference on. There's more of awareness on the higher income bracket than what I would have expected. It seems to be fairly evenly split across socioeconomic backgrounds. If I filter specifically by 100K or higher, I can kind of tweak the results a little bit and see that there's some lack of awareness, but I don't have enough respondents in that category to really draw any meaningful conclusions from. On question 18, that deals specifically with socioeconomic status and minority identifying status, you can see that the results are much the same across both of these questions, which I think both question 17 and question 18, they're asking very similar things, and you can see that the people who have answered this have answered both questions in the same fashion, which is kind of supporting evidence to make me feel good about the accuracy and the validity of the data. The one caveat being is that a significant portion of the people who have answered the survey either have direct experience with, either professionally or personally, with substance abuse or mental health challenges, and attempting to reach the wider community who do not have any experience with that is one of the goals that we have. We'll be reopening the survey later on to attempt to try to get people who don't have experience with it so that we can get more of a bellwether of the public at large with it.
Yeah, I would say too, though, that the amount of people who are like untouched by addiction is getting smaller and smaller. So lived experience is kind of, it's an interesting phrase because it can mean a few different things. But yeah, I agree. I think, you know, this is obviously community issues, so we do want to try and get people who have nothing to do with substances whatsoever to try and weigh in a little bit. So like Blake said, he and I are going to keep some version of that open at various times, and then even like try to get some more qualitative information. So you may get a call from me or Blake saying like, hey, can we come and chat with you for like half an hour to kind of dig in a little bit more into some of like the qualitative as opposed to the quantitative. But yeah, I'm happy to share that with everybody. We just submitted it like as our deliverable, so I don't know if we're gonna put it out right away, but as soon as we do, I'm gonna blast that out through the mailer. So I don't know, there was a lot of information we dumped on you. Is there any questions anybody had about some of the stuff that we found through the answers on this survey, or any comments or anything stick out to anybody? Oh, you know what? Let's do this. I forgot. Great. That's a great point, Felicia. I'm going to share again real quick because we did do a word cloud. So hang on one second. So the last question on the survey was open-ended. So it said if there's anything we didn't cover, if there was anything that you feel like we need to look at, we did provide an open-ended one. And that's what we kind of did a word cloud for. So if you can see up there, the big words are the words that repeated quite often in there. So insurance, transportation, some of these you can just knock out, like treatment. People are going to talk about treatment, but housing, education, things like that. So it's not, this part didn't tell us anything we didn't already kind of anecdotally know, but it was good to get it at a large scale, because then we kind of see that that was a lot of people's take on, you know, what the real barriers were to them. So that's kind of what we saw as far as that goes. Any other questions or comments or anything as it relates to this survey? Ben, I see your hand up.
Yeah, I just muted myself. There we are. I think it's a point well taken that Blake brought up. Just sort of the opinions of like an average person, a person who doesn't feel like they're directly influenced by drug addiction or mental health concerns. That's a big kind of empty spot, you know, that whether they're business owners or just average middle class people working jobs that don't have, you know, so the survey is kind of pushed toward people who have a substance use dependency, mental health, either concerns or experience and all of that. So a lot of my interest is like, well, what does just average people? As an activist in my community, it's interesting talking to my neighbors about how they view things, you know, that there's not a problem, you know, or that they don't know anything, you know, finding the gaps in their knowledge of just average people and what they think about that. And what they
That's where
think.
I think
Yeah.
I agree, and I think that's where and I brought it up a couple times. I think that's where having a survey available or open in the spring and the summer could help quite a bit. And reasons why Blake and I are going to keep some of those questions specifically open, if not the whole thing, at different times. Like when we're out in the summertime doing events and things like that that aren't specifically substance use or mental health events, like that's where we're going to try and get. So we'll look forward to seeing what the addendum is, you know, after we get some of those folks too down the line. But yeah, we're on the same page as far as that goes.
Hey, Jarrett, this is Jory. I don't know if I missed it, but do you guys have a plan to share this data with other community groups or like
Yeah.
during mental health month or any recovery month, maybe?
Yep, happy to do that.
Okay.
All our stuff is like open source, like we share it to everybody with everything. I mean, this was a truly like community-based thing. This isn't just for our internals. The one we did a few years ago is actually up, and then we did focus groups the past 2 years. We have those available too. If anyone ever wants to take a look at that, I think the first focus group we did was more generalized, like barriers and gaps. But last year we did one that was specifically for justice involved people to talk about their recovery process in being formerly incarcerated or on probation or problem solving court. So we're always looking for broad-based stuff, but at the same time digging down deep into very specific areas. So hopefully we'll continue to do that this summer with that survey. So yeah, good question.
Thanks.
All right. Any other questions on that? All right. Well, hey, thank you, Blake. Thank you for your help with that. And yeah, maybe in a few months as we get to the end of summer, we can maybe have an update on some of those questions if we get the net cast a little bit wider on that. So with the time we have left, was there any organizational updates? Is there any folks on here who would like to talk about upcoming meetings or trainings or events that they have? Jory, everyone's awing at your son. Yeah.
Sorry, I was trying not to, but I have to. He's a
Very cute.
future community health worker right here.
Oh, heck yeah. We love to hear it. We love to hear it. Anyone here in person have anything? Alex. Here we go. I'm going to make sure I turn this on. I'll turn.
All right. So I just wanted to promote an upcoming event that we have coming up in April, and we are collaborating with the YWCA and Benedictine University to host Take Back the Night. So it's It's a national annual survivor event to support survivors of sexual and domestic violence. And it's really just a night. The theme of Take Back the Night is that oftentimes sexual assault happens in the evening time. And so the idea is that we want to take back the night as survivors. So it's really about showing solidarity and empowering survivors. And so we have a resource fair that we'll be doing. So we invite anybody who's interested in tabling to be a part of it. We have a solidarity march, and then we have a survivor speak out. So this is, like I said, in April on Wednesday, 16th. We'll be doing it from 10:30 to 3 this year. So I know it's called Take Back the Night, but we did do it in the evening time last year. And we noticed, because we're at Benedictine, that it's a commuter school and not a lot of students are able to engage. And so we are shining a light on Take Back the Night by doing it during the day, in the daylight, so that we have more visibility, essentially. So we're super excited about it. I know Serenity House usually joins us. Anybody else is interested in joining us, please feel free to get connected with us. I'm with Family Shelter Service, so we would love to host anyone for a resource fair.
Quick, Sarah in the chat says, where can we find info on tabling?
Yes. Oh, great question. Oh, and my colleague Erica has answered that in the chat. So please reach out to Erica. Thank you so much, Erica.
All right. Thanks, Alex. That's great. Great event. Great event. If you've not attended a Take Back the Night event, it's very, very powerful. And there's a lot of great partners involved in this one. So I hope you can make it out to that one. Anybody else? Anything to promote? Any questions, comments, concerns? Mark Matthews, come on down. You're the next contestant. He is just back from a honeymoon, folks. He's tan, rested, and ready.
All right. Yeah. No, thank you. Mark Matthews, peer recovery support with Greater Family Health. I wanted to give a big shout out to Danielle Heffernan. Again, does an amazing job at the naloxone training. In attending that naloxone training, I was able to kind of trade some notes and get a little up on my game. And in doing so, my organization and our Kane County Health Department grant has allowed me to train not only 70 of our providers on naloxone training through our 11 locations, but also today I got to do my first collaboration with ECC. So I was able to naloxone train a bunch of their CRSS peer supporters over there. So again, it's the seed plants the seed, plants the seed, plants the seed. So I wanted to make sure I give a big props to Danielle and the RCO. So
I do see a hand up. John, you got something you would like to promote or bring up about a position possibly, right?
Hi, thanks, Jared. I just wanted to mention that Arab American Family Services is hiring therapists, mental health, and any other options available. They're doing a lot of work with refugees, and they're really, really looking for some multilingual providers, particularly to Arab languages or around that region. So if anyone knows anyone or if anyone is interested, feel free. You can reach out to me if you'd like, or I can provide you the contact information to that agency. But thanks for letting me mention that.
Can you, real quick, what was that agency again? I'm sorry, I missed the first part of it.
It's Arab American Family Services.
Okay. Do you know where they're based out of physically? Somewhere up here, DuPage or surrounding area?
Yes, I think Cook, and I think it starts with a W, actually.
Okay. Will?
Yeah, I'm not going to hold you up on it, but
that's okay.
No,
well,
give me
yeah,
a second.
We'll make sure to find the information. So yeah,
I can throw it in.
Yeah, absolutely. So yeah, thank you, John. Appreciate it. John Schoes, the winner of the Referral Hub MVP of the year last year. He's making his triumphant return, everybody. All right. Any other comments, questions, things people want to promote online or here in person? Going once, going twice. Okay. Well, hey, thank you to everybody. Thank you for allowing us to kind of move some things on the fly. Apologies again for RC not being able to attend. Obviously, there's a lot of illness going around. We hope that everybody stays safe, stays well. Join us next Wednesday for that EBA game presentation in the morning. And then the next ROSC Council meeting is actually going to be on Wednesday, April 9th at 3 p.m. And I believe, according to my notes, we have our friends from HeartLife over in Will and Grundy County to talk about the ROSC work that they're doing. We have tons of great neighbors and great ROSC doing great work in Northern Illinois. So it's always important to try and shine a light on what's happening next door. So hope you can join us for that. I'll have the video of this up hopefully tomorrow. All of our meetings, all of our presentations are on our YouTube page. So if you ever miss one, you can always catch them on there. And then other than that, you get 4 minutes of your day back. Thank you, everybody. And we'll see you at the next one.
Thanks,
Thanks.
Garrett. Bye.
Bye.